Welcome to these additional episodes of Your Pregnancy Week by Week. We're going to provide information about things you may want to know about before baby's birth and in the weeks and months after baby arrives. Dr. Glade Curtis and I hope these discussions will help you and your partner settle into your new roles as parents. The information in these episodes is a general informative guide. None of the information we provide is intended to replace, countermand, or conflict with the advice given to you by your own doctors. Always follow his or her advice. Use the information you learn here as a starting place in your dialogue to help you put your life with baby and after pregnancy concerns, questions, or interests into words. Each episode will cover one topic. Our discussions are intended to help guide you through the many new experiences awaiting you. So let's get started on this discussion. We're going to talk about respiratory syncytial virus in your baby. Respiratory syncytial virus, or RSV, is an infection in the lungs that most often occurs in the winter and spring months. Each year, more than 125,000 babies are hospitalized with RSV. Good news, it's rare in children over 2 years of age. RSV begins like a common cold, with nasal discharge and a mild fever, and it can last for several weeks. Most children easily fight off the virus. However, some infants get ill because their bodies can't fight infection as well. If RSV spreads to the lungs, it can cause pneumonia. Babies gradually develop respiratory distress with rapid breathing, coughing, irritability, and possible wheezing. They can become listless or stop nursing. They may also have episodes of apnea, pauses in breathing lasting longer than 15 to 20 seconds. Research has found some children are at more risk. These children include babies who were born earlier than 36 weeks, have lung disease, have heart disease, are in daycare, have school-age siblings, or those who are exposed to secondhand tobacco smoke. Research shows if a baby suffers from RSV, he will have an increased risk of asthma and other respiratory problems in adulthood. What can you do to keep baby safe? Keep sick people away from him, especially from fall through spring. Don't allow anyone to smoke around you or baby. Breathing in smoke makes him more prone to infection. Frequently wash your hands with soap and water to prevent passing germs to baby. Be scrupulous about cleaning hard surfaces at home. Be sure baby's daycare is also very clean. Avoid crowded places such as shopping malls, grocery stores, or any place large groups gather. Use a cool mist humidifier in his room. Give him lots of fluids. Keep him quiet. Depending on baby's age, acetaminophen may help ease discomfort and reduce fever, but always check with your doctor before you give any over-the-counter meds to baby. Call your pediatrician if baby's coughing increases, he wheezes, breathes more than 50 breaths a minute, or if the skin between his ribs is pulled taut with breathing. Call your physician if your child has a fever of 101 degrees or higher, or if baby seems dehydrated. Notify the doctor if baby's skin becomes blue or gray, he is extremely irritable, he has apnea spells, or is very listless. Your doctor can confirm the RSV infection by checking for antibodies. X-rays may be taken to check for pneumonia. In some cases, steroid medications may be prescribed. However, not everyone agrees this treatment is effective. Or an antiviral agent may be given to baby, but its use is controversial and expensive. In some cases, baby may be hospitalized and given mist therapy combined with oxygen. He may be given an IV if he's unable to eat. In severe cases, a ventilator may be used to assist and/or control breathing. If baby was premature, ask your doctor about medication that prevents RSV. He or she will be able to give you further information. If you'd like to read about baby, check out our book, Your Baby's First Year, Week by Week. We cover many subjects dealing with baby in a weekly format. Each week is a fairly quick read. If you want to find out more about this podcast, visit our website, yourpregnancyweekbyweek.com. If you're looking for something specific, check out the podcast topics list. It lists topics about baby covered in our Let's Explore More segments. Follow us on social media for updates, new podcast episodes, and other important information. Visit Your Pregnancy Week by Week, all one word, on Facebook and Instagram.